My PowerPoint is over congenital pulmonary airway malformation. What is congenital pulmonary airway malformation? It is also known as CPAM. It is a rare congenital defect. It is a cystic mass which forms in the lung tissue of a baby in the womb, usually located on one lung, and it prevents normal growth of that lung. It also can sometimes cause a shift to the opposite side of the chest and press down on the diaphragm. There are different types of CPAM. The two that are classified is the macrocystic and the microcystic. The macrocystic are the lesions that contain large cysts on the lungs after birth, and they are actually found by doing an ultrasound on the lungs of the fetus, and they account for 50% of the postnatal cases. These types of cysts have favorable outcomes. The microcystic are smaller cysts that appear as an abnormal looking lung, and they account for 40% of postnatal cases. The outcome for these cysts is determined by the size and compression on the other organs and if they're treatable. How does CPAM affect the baby? Some babies cannot breathe effectively when they are born, which will require immediate intervention. Ultimately, it can lead to heart failure and lung failure due to the cyst compression on the lungs and the heart. How is CPAM diagnosed? It can be diagnosed 3 different ways. It can be done with an ultrasound during a routine prenatal exam, or it can be done by an echo, and the echo will rule out other heart defects and assess the heart function, as well as advanced fetal MRI. The fetal MRI will identify the size and location of the cyst itself. After the child is born, some signs and symptoms of CPAM are respiratory distress, recurrent infections, coughing up blood, shortness of breath, and cough. The only type of treatment for CPAM is surgical removal of the affected area of the lung. This is done by removal of the lung lesions, and it can be done by open surgery or small incisions on the sides where the lung is located. What is the prognosis? The prognosis depends on the size of the cyst and how much compression is on the other lung or other organs. It can affect the pumping of the heart as well as how the lungs function. And as far as the prognosis goes, if it's in utero, the baby's in utero, and the cyst grows too big, too fast, the baby could potentially die. But if it's outside after birth and it grows, it can cause respiratory issues, and they would treat it with surgery to remove that cyst. A nursing diagnosis and intervention for congenital pulmonary airway malformation is ineffective breathing pattern as evidenced by shortness of breath related to cyst on the lung, fast respiratory rate, and compression of lungs. Some interventions that would be for this is provide respiratory medications and oxygen per the doctor's orders, place patient in semi-Fowler's position, encourage small frequent meals, and suction secretions as necessary. Overall, as long as the cyst is removed, the lung compensates and regrows what was removed, and there are no further complications that exist in the baby, and the baby can lead a normal lifestyle.